Hi, everybody. Thank you so much for joining us. We are going to get started in just a couple of minutes. We're going to wait for some folks to finish logging on and getting everything together. So thanks. Hi, everyone. Thank you so much for joining us. My name is Amber Crossan. I am the Communications Coordinator for Heartland Alliance's Research and Policy Division. Thank you for joining our webinar this afternoon. We are going to be discussing the 2018 Illinois poverty data that the Social Impact Research Center has just released. Today, we are going to be be joined by Katie Buitrago, who is the Director of the Social Impact Research Center at Heartland Alliance, and we are also going to be joined by Megan Craig, who is the Director of Programs at the National Kidney Foundation of Illinois. So just a couple of things before we get started, some housekeeping things. We are going to be doing a Q&A at the end of the presentation today. So before that time, or when we get to that time in the presentation, please feel free to use the chat box that you will see to the right of your screen. That's where you can let us know if there's any technical issues that you're running into or any questions that you want us to address. We are also going to be having this recording of the presentation as well as the slides available for you, hopefully within the next 24 hours after the presentation. So with that, I will hand it over to Katie Buitrago.
Thank you, Amber, and thank you to everyone who's joined our webinar today. We're really glad that you're interested in learning more about how to use the local data on poverty and well-being that we're releasing this year. I'm with the Social Impact Research Center, which is a program of Heartland Alliance, which is the leading anti-poverty organization in the Midwest. We have direct service efforts in 100 communities nationwide in 12 countries throughout the world. We also do research and evaluation, policy and advocacy, and systems change to try to make systems work more equitably for our participants. We believe society is better for everyone when all of us can participate, prosper, and reach our full potential. And the Social Impact Research Center specifically conducts research that helps Heartland Alliance and leaders throughout communities create change. For more than 2 decades, we've equipped nonprofits, foundations, and governments with the knowledge needed to advance real-world solutions to poverty. And this data release is an integral part of that. We do a lot of research here at Heartland Alliance to go in depth on certain questions to figure out our anti-poverty programs working the way they should, what are the needs in our communities, how can we craft policies to address those needs. But we know that we're just a small team and we can't answer every question. So we want to put out resources like this local data to help you answer your own questions, which is what we'll be walking through a little bit today. And part of that, is translating data from knowledge into action. And that's where you all come in, is on the action front and using that knowledge to make change. So you might be wondering why bother analyzing local data on poverty and well-being. My least favorite reason is because you probably have to. You might be required to assess local data by funders or other compliance requirements in order to understand whether you're targeting your resources effectively or to make the case for need. So even at bare bones, this is an important skill to have, whether you want to go further than that or not. It's also important. It will help you understand areas of need in your community. It can help show what the conditions are on the ground and how they've changed over time in your neighborhood. You might want to understand how your community compares to others. You know, when you see a rate or a number, it's hard to understand, is that a good unemployment rate, bad unemployment rate? And comparing to other communities can help you have that context to interpret what's going on. A lot of us are working with limited resources, and you want to make sure that you're targeting your resources effectively, and data to help you see where areas of need are can help you target your limited resources. It's also extremely valuable for raising awareness, making the case for your programming, and communicating more effectively. You can plug in numbers about the issues that are faced by your community into letters to the editor, or fact sheets for policymakers, or editorials, or things like that, your annual report. And this can help you communicate how what you're doing is important for the people that you serve. And the data I'm going to walk through are from a number of different locations. One is the U.S. Census Bureau, the American Community Survey, which is part of the Census Bureau. We also use a number of Illinois state agency data sets and other data sources from researchers across the country. And we select these sources because when people talk about poverty, what they're really talking about in many cases about people's quality of life, not whether their income is above or below a certain threshold that's somewhat arbitrary. We want to release data on more than just income poverty in order to paint a richer picture of well-being and quality of life throughout communities in Illinois. So we're trying to find data on well-being from as many sources that we can at local levels. And these are the most rigorous data sources available on these indicators, whether it's from the census, universities, the state government, or other well-regarded researchers, such as the MIT Living Wage Calculator, Illinois Early Childhood Asset Map, National Low-Income Housing Coalition, Feeding America, and CFED. And we're also limited just by the available data that's available at the local and county levels. A lot of data sets out there might cover more indicators than what we've provided, but they're only available at the state or national level. So we want to find data that's rigorous and available at the local level in a way that is statistically reliable. So just to get into what everyone cares about, I'm going to take you to the website so we can navigate the data. The data are housed on our website, 2018.ilpovertyreport.org. When you come to the website, you'll see this map. And you can click through on the map in order to explore the data. Say you want to see Vermilion County, you see this tooltip that pops up and shows a couple of key indicators: poverty, unemployment, teen birth rate, and high school graduation rate, and what the value is in that county and how it's changed from the previous year. You can also click over to other counties just to explore the data on a high level. And you can click here to see more information about this county. So you click through and get this fact sheet. It shows whether they're on our well-being index, which I'll explain shortly. It'll show the data that goes into that well-being index, how the county compares to Illinois, and how both the county and Illinois have changed over time. And then we have a number of indicators about poverty and income, employment, education, housing, health and nutrition, and assets. And then at the bottom, there's more information about where the source data is from if you want to go back and explore it yourself. You can also print out or save this information by clicking the Print County Data button. And you can either send it to your printer or save it as a PDF. And you can use that in your communications and things like that. Another way to sort of explore the data at a high level is to look at the Illinois poverty map. So this shows just poverty rates and the number of people in poverty throughout Illinois. And the areas that are in dark green have poverty rates that are very high, where the light green have lower poverty rates. And the number of people in poverty shows the people of 3 people have the highest numbers of people in poverty, whereas 1 has the lower numbers. So in more populous counties, you can have a high number of people with poverty and a low concentration just based on the size of the population there. So both of these resources are good if you're just trying to explore the data at a high level and get a quick overview of well-being in your community. But if you want to dig deeper, I recommend you check out our local and county data. We release data in the Chicago area. We have Chicago community area indicators, as well as data on municipalities within the Chicago 6-county region. And in addition to that, we also have data for all the counties at the county level in Illinois, which I will show you shortly. So first, what is in the data? When you open our Cook County data, you'll see this information page that has links to all the data sources. Sorry, this is the wrong file. So yes, you'll see also, this is our county data book, so this has all the counties in Illinois. Has citations for all of the data sources in this book. We have information on the County Wellbeing Index, which is a measure that we've come up with to highlight counties that are experiencing particularly negative conditions on 4 key indicators: poverty, unemployment, teen birth, and high school graduation. And these indicators have been shown in the research to be highly predictive of future outcomes. These counties are evaluated using a point system with a higher number of points indicating a worse score. A county receives a point if the rate is worse than the state average and or if it's worsened since the previous year, for a total of 8 possible points. So this tab has all the values for every county in Illinois on those 4 indicators, both how what the rate is or what the number is and how it's changed. You can compare it to Illinois and to other counties. And we also have the number of points it has on our index and whether it's on a watch list or a warning list, which has the highest level of risk. We also have data on poverty and income, number of people in poverty, child poverty, household income, and also what wage it would take in that county in order to actually survive given the cost of living, which is a different question than what poverty is. We have information on unemployment rate. We rank the counties by the severity of their unemployment rate, number of unemployed people, unemployment insurance claims, and a lot of change over time measures. We have information on education, looking at Head Start, high school graduation rate, ACT scores, and scores on key standardized tests. We have housing information, looking at whether people are renters or homeowners, what the fair market rent is in that county, what the average wage is for renters in that county, and then we have a number of measures of looking at housing affordability as well, including severe rent burden, which looks at the % of people who spent more than half of their income on rent. We have information on health and nutrition, including health uninsurance rates, low birth weight babies, families that receive SNAP, food insecurity, which looks at whether you know where your next meal is coming from, and child food insecurity as well. We have information on assets, including home ownership, population with a bachelor's degree or higher, asset poverty rate, which and liquid asset poverty rate, and the % of households who do not engage with the banking system, and the % of households that might be engaged with the banking system in a limited way. They might have an account, but primarily do their financial services through payday lenders or check cashers or things like that. And then we have a slightly different set of indicators for our Chicago community area and our Chicago region municipality data, just because the smaller geography you get, the more limited your options are for your data. So we have the same set of information, the Chicago community area and the counties. So I'm just going to walk through Chicago community area. You have information on the racial makeup of each community area, poverty rates, extreme poverty rates, so that's people who are below half of the federal poverty line, low income rates, which are people who are less than 2 times the federal poverty line, educational attainment, so looking at the highest degree achieved in that community area, that housing burden calculation again. The standard housing burden rate looks at whether you're paying 30% or more of your income on housing costs, and severe housing burden, which looks at 50% or more of your income. People receiving public assistance, cash public assistance, people receiving SNAP, employment status and the composition of the labor force, poverty status by family type, the rates of renters and homeowners in the community, housing vacancy rates, the poverty status of children in that community, and also different family types, you know, married couples with children versus single parent households. So that's just a quick overview of what's in the data. I hope you can see that there's a lot of richness here and that you can hopefully plug this into your work in many ways. I'm going to quickly talk through so a couple of examples of how you might use the data. So one profile, you might be a program officer at a foundation, and your board has just decided that you're going to change your giving priorities. So you might, sorry, I'm going to pull this data back up. And so the new giving priorities say that you're supposed to target your funding in areas that have high poverty rates, low educational attainment, and high housing vacancy rates in the city of Chicago. So we're going to look at actually just high poverty rates and low educational attainment. So I'm going to walk through, you know, you've been given this directive from your board. How are you going to figure out where you're going to target your funding for high poverty, low educational attainment areas? I'm going to start on these examples with the caveat that they require some familiarity with Excel. If you get totally lost on these or have never seen these functions before, you're always welcome to contact us for technical assistance. But I wanted to put this out there to see, you know, teach you a couple of Excel tricks and help you understand how to explore the data. So first we need to define these terms, like what is high poverty? For the purposes of this example, we'll look at poverty rates that are higher than the city average. And what would low educational attainment be? We're going to look at educational attainment rates that are higher than the city on no high school diploma. So we're going to go dig into the data, the Chicago community area data, and first we're going to look at the poverty data. We're going to scroll over and find the poverty tab. We need to create an indicator of whether a community is considered high poverty or not. So I'm going to insert a new column here next to the poverty rate, and I'm going to name this column indicator of high poverty. So what we're going to do is we're going to create a formula in Excel that will compare this rate right here, so the community area rate, to the Chicago rate, which is down here at the bottom. I'm going to create this formula. And you can see the formula both in the cell, but also at the bar at the top of the screen up here. You're going to type if, parentheses, and then if this, you're going to click the Rogers Park value, insert the greater than symbol, and then scroll down to find Chicago and click that one. So you're saying if Rogers Park's poverty rate is greater than Chicago, and put in a comma, you have to tell you what value you want it to say if that's true. So we're going to put in 1, then another comma, and then 0. So what this formula is saying, it's telling Excel to compare Rogers Park's poverty rate to Chicago's poverty rate and return a value of 1 if Rogers Park is higher than Chicago, and a value of 0 if Rogers Park is lower than Chicago. So I'm going to hit enter, and it shows 100% because this is formatted like a percentage. I'm just going to change that to number. So it's giving us the number 1. So that's telling us that Rogers Park's poverty rate is indeed higher than the city of Chicago average. So this is a high poverty community by our definition. And so now we want to be able to copy this formula all the way down so we can compare every community area to the Chicago rate. One Excel trick is if you click and drag this formula on this bottom right-hand corner here, it'll shift the formula down row by row. So that's good. We want to do that for the community areas. We don't want to do that for the Chicago value because we want to compare to Chicago every time. So what we're going to do is going to put what are called anchors in this formula, so it'll tell not to move the Chicago comparison. It will compare to Chicago every time. And those are just dollar signs. So you're going to put in a dollar sign before the letter G in G84, and a dollar sign before the 84 as well, and click enter. And you'll still see the same thing. It hasn't changed the formula. They'll just change what it's pointing to slightly. So now I'm going to double click the bottom right corner of this box, and it'll carry the formula all the way down. So it'll create an indicator for every community area to show whether it's a high poverty or a low poverty neighborhood. You can scroll all the way to the bottom, and it'll show you it's still comparing Edgewater's rate to Chicago's rate. And if we hadn't added those dollar signs, it would be comparing Edgewater to a blank cell somewhere at the bottom. So it's really important to do that. And at the end, if people still have questions about this or want me to repeat this, I'm happy to go through it again, but I'm going to go through the same thing right now for educational attainment. We need to create an indicator for low educational attainment communities. You're going to go to the Educational Attainment tab, and we're going to find the rate for people who have less than a high school diploma. We're going to insert a new column, name it Indicator of Low Educational Attainment. I'm just going to shorten that. And then we're going to type a very similar formula. We're going to do another if statement. Click on Rogers Park, the greater than sign, and go down to the Chicago value. And then put a comma, then 1, then 0, and close parentheses. So again, this is formatted like a percentage. You go to this drop down here at the top to change the formatting, change it to a number. I'm going to reduce the number of decimal places. So Rogers Park rate of people without a high school diploma is lower than Chicago. So that's not showing up as a low educational attainment neighborhood. Again, I'm going to go add the dollar signs in order to anchor it to the city of Chicago rate. And now I'm going to double click and carry it all the way to the bottom. So you can see some communities have a higher rate than the city of Chicago on whether you have a high school diploma or not. So now we have two columns, one that shows whether it's a high poverty neighborhood and one that shows whether it's a low educational attainment neighborhood. We need to combine those to figure out which communities show up on both lists. So I just created a new sheet, and then I'm going to go and copy this information from the tabs we were working with. I'm going to copy the list of community area names. Go back to this new sheet, insert them here. I'm going to go to poverty, and I'm going to copy the column we created, which is the indicator of high poverty. Put that here. And when you copy, you have this little tooltip will show up, giving you options for when you paste. And you want to make sure to click on that and click paste values. You only want the ones and zeros. You don't want the formulas. Because if you copy the formulas, it'll just be comparing to a blank cell on this new sheet. So you copy and paste paste only the values. And we're going to do the same thing with educational attainment. And copy this low educational attainment column. Put that in the new sheet. Paste it in, and then click paste values. And I'm going to make sure we can read both of these. So now we have just a table that has all the community areas, whether they're high poverty and whether they're low educational attainment. And we need to figure out which are on both lists. So I'm going to highlight these column titles here and go to the Data tab at the top, and then click Filter. And this will allow you to display only certain values of the table. So I want to see just the community areas that have a 1 for indicator of high poverty, as well as a 1 for indicator of low educational attainment. And then I'm going to sort it alphabetically just so it's easier to read. So now here's your list of communities that are both high poverty and low educational attainment in the city of Chicago. You can take this back to your board at your foundation and say, here's what communities match our giving requirements. The next example, so pretend you're a journalist for the State Journal Register, and your editor has come to you and says that she's heard a lot of talk about hunger in Sangamon County, and she wants you to look into how bad it is. So that's a pretty vague question, but this data can help you investigate it in different ways. So you want to go to our county data book, and you want to you want to look at our food insecurity indicator, which shows whether families know where their next meal is coming from. So first you go into our health and nutrition tab, and we're going to use that filter feature again that we just used. So go to data, click filter, and then you can filter from high to low on the food insecurity rate. So sort largest to smallest. So it'll show the counties with the highest food insecurity rate at the top over here, and the lowest is at the bottom. So now you can just look through and find Sangamon County. It's right here, row number 23. So you might think, oh, this is the number 23 worst county in Illinois in terms of food insecurity. That's not quite true because the first row is just the titles, so it's actually the number 22 worst county in Illinois. So that could be one way to frame it to your editor. But you can also compare the food insecurity rate in Sangamon County to the state average. So I'm just going to sort it alphabetically so I can find the geographies easier. So there's Illinois, it's right here in the middle. And then Sangamon County is down here. I'm going to find food insecurity rate and create a new column right next to that we can put new formulas in. I'm going to go back down, find Sangamon, and I'm going to take the Sangamon rate and subtract the Illinois rate from it to see how different they are. Scroll back up, find Illinois, and hit enter. So this shows that Sangamon County's food insecurity rate is 1.9 percentage points higher than Illinois. But you might be more interested in seeing how Sangamon County compares to its neighbors rather than the state average. So you could take, again, you will delete this formula, we'll start over there. Menard County is a neighboring county to Sangamon. So you click here and then divide and find Menard County. Click on Menard. And this is formatted as a percentage. So we want to go and change that so it just shows us a number. So it's showing us 1.33. And this means that Sangamon County's food insecurity rate is 1.33 times higher than Menard County's. So as a reporter, you might want to investigate why is hunger worse in Sangamon County compared to Menard. Is Menard doing something differently about this? So this is what we call exploratory data analysis. It doesn't tell you the whole story, but it can target further research or further reporting to figure out what phenomena are happening on the ground. And now I'm going to pass it over to Megan from the National Kidney Foundation of Illinois. And I will advance to that slide. All right, thank you, Megan.
Thanks. So we just wanted to go over quickly a real-life example of this data having been used. So just briefly, the National Kidney Foundation of Illinois improves the health and well-being of those at risk for or affected by kidney disease through prevention, education, and empowerment. One of our cornerstone programs, our key prevention program, is our Kidney Mobile program. This health screening program screens for diabetes, high blood pressure, and kidney disease. We serve more than 30 counties with about 70 screenings per year. And we've screened more than 55,000 people in Illinois since the program began in 2006. Many of those in the past several years as the program has expanded with more partnerships. So the reason we test for diabetes and high blood pressure in addition to kidney disease is because uncontrolled diabetes and uncontrolled high blood pressure are the leading causes of kidney disease. So when we're trying to find out who needs this testing, we realized we wanted to target communities with a higher incidence of diabetes and high blood pressure. And there is a higher incidence of these issues among people living in poverty. Also, we knew that those without health insurance were less likely to seek treatment if they already knew they had these issues. So by screening them, we were then able to also provide resources at the end of the screening. So when the Affordable Care Act came along, we had to sort of rethink how we were selecting where we would take the Kidney Mobile in Illinois. We had been basing our partnerships on areas with high uninsurance rates, which of course is a great indicator of people who need extra help with healthcare. However, after Affordable Care Act, more people were insured in Illinois and across the United States. So we knew we needed to target people based on other data. So in 2015, we created our first Kidney Mobile heat map. We used the data from the Heartland Alliance as well as CDC data to target locations. So in this map, you'll see Chicago by zip code. So we took data that showed us poverty rates of 25% or higher, adult diabetes rates of 11% or higher, and then you can see in green places where we have both high poverty and high diabetes rates. So those green areas, we knew once we combined the poverty rates and the diabetes rates, we have to take the Kidney Mobile to those areas because those are places where kidney disease is more likely to be rampant when people have diabetes that they have no way to control. They may not even know they have diabetes in some cases if they aren't communicating effectively with their healthcare providers. And then people living in poverty, again, less likely to seek medical care that they may not be able to afford. Same deal for Illinois. We used the same types of data, obviously different data sets. Cook County we excluded because our Chicago data showed us most of what we needed to know in Cook County. But we compared poverty rates of 17.9% or higher at the time. This map is now a couple of years old. And adult diabetes rates of 12.3% or higher. And then obviously, again, in green, you can see both high poverty and high diabetes rates. So we knew those counties are counties we have to hit. We know that we have a limited amount of resources for the Kidney Mobile. We know that we can't go everywhere because we don't have the staff for that. So we expanded our downstate swings, as we call them, where we take the Kidney Mobile to these southern counties in Illinois. Oddly, downstate also counts for these far north counties. Anything outside of Cook is downstate to us. So rather than doing one or two downstate swings like we did before, once we saw this data, we realized, okay, there is a really high need, especially in these far south counties, and we added an extra 2 or 3, so we now do 4 downstate swings a year, all thanks to knowing that this existed. So just some stats of our own. You can see the number of screenings we did in 2016. Something to note is that in 2016, once we were using our heat map, we had more than 70% of participants with at least one significantly abnormal result show up at our screenings, which helped to tell us that we were targeting at least somewhat correctly. We also referred a significant number of people for immediate follow-up care with a federally qualified health center in their area. So even people who were uninsured or possibly were insured but didn't feel that they could use that insurance just because even co-pays were too high for them, we were able to help connect those people with care that they needed. Our hope then, of course, being that if we help people control these precursors for kidney disease, we will help control kidney disease in Illinois. And then you can just see some 2017, same deal. And so far in 2018, we're only 25 screenings in, but 23 of those have been in our target areas. You can see this huge number of people with at least one significantly abnormal result of the number of people we've screened. And you can see the uninsured rate continues to go down. as the years go on. That's not through any targeting of ours, that just we think is probably related to Affordable Care Act. And that's our example.
Thank you so much, Meg, and I think that was a really great example for how you can use data to help make decisions when we can't, unfortunately, serve everyone that needs to be served. And so now we have time open for questions. We've been getting questions throughout, but we're also continuing to take them, so please put them in the chat box if you have them. So I'm going to go through some of the questions we've gotten already. One question is about the American Community Survey and whether it releases data at the Chicago community area level. That's correct. It's not one of the default geographies from the American Community Survey. However, Chicago community areas are accumulations of census tracts. So we have here at Impact a table that shows which census tracts are in Chicago community areas. There's a couple that cross community area boundaries just to make our life difficult. But we basically add up census tracts or do whatever operation to combine them in order to create the Chicago community area numbers. But that's correct, that it's not by default on the American Community Survey website. Another question is asking about whether, for people who aren't super familiar with Excel, will there be a brief user guide with the examples we just walked through? We hadn't planned on doing that, but that's a great idea. So we will try to write something up that explains the steps we just walked through. Someone asked the level of overlap between our data and the one on Health Chicago 2.0, which is a great website also. I can't get into the specifics of that. I don't have it all on the top of my head, but I will say I know Healthy Chicago 2.0 did some original data collection on their own. So they did surveys and things like that that were sort of point-in-time estimates. So they haven't necessarily all been updated recently. So we did not include that in our data. But I think they also used some of the same data sources from the Illinois Department of Public Health or the American Community Survey. So there's some overlap there. And also, of course, they only have Chicago data, whereas we have data for the Chicago region and for the state as well. There's a question about when the liquid asset poverty rate data will be updated. You'd have to direct to the data source, which is CFED. We haven't heard from them what the plans are to update that. We have a couple questions about whether it's available at the zip code level. That's not something we put out by default, just because we haven't, in our experience, people haven't asked us for it as much. But if you have questions about specific zip codes, you can reach out to us. I'll pull up. Can you advance the slide one more, Megan? Yeah, you can reach out to us on social media and that email address. And if you have questions about specific zip codes, and we can help you out with that. Someone asked, what is the difference between the watch and the warning list, other than warning being worse? Really, that's the main difference, is that counties that are on the warning list have more areas where they're either worse than the state average or getting worse over time. And counties can end up on the warning list for a variety of reasons. It could be mainly about their teen birth rate or mainly about their poverty rate, unemployment rate. So you'd have to really look at each county to figure out what's going on there and what indicators are putting them on the list. But it's more about severity of need. So the warning list has more severe need. The watch list has slightly less severe need. We're going to check for more questions. Got a question about whether we'll share the presentation. Yes, we will. There's a question about whether we have an interactive map building program on our site that we could use to build interactive maps. We unfortunately don't have that functionality right now, but we're looking into ways to make the data more interactive so it doesn't rely on people knowing how to use Excel. So it might look very different next year. Any of the data broken down by, the question is, are the data on rent burden broken down by age? We don't release that as part of our data books. The source data might have that. So if you have very specific questions like that, where it's broken down by different racial groups or by different age groups, reach out to us and we can look into it. Sometimes the issue is not that it's unavailable, but that the sample is too small to really be a reliable estimate. If you have any more questions, please send them in. We got a shout out for the National Kidney Foundation of Illinois. Thanks for the downstate kidney mobile visits. We appreciate it, from Jackson County.
Oh, hi, Jackson County.
Yeah. And then another message encouraging us to visit Chicago Hack Night and present this data. And perhaps some of the developers there would be interested in building an interactive map for us. I've been to Hack Night before. I think that's a great idea and would love to get some creative thinking from the developers who go there. So thanks for that suggestion. So does the Social Impact Research Center provide input regarding evidence-based strategies to improve some of these indicators? We absolutely do that type of work with our research partners and also internally with Heartland. So if you have a specific research project or you want more information on best practices, evidence-based strategies, assessment tools, feel free to reach out to us, and we do engage in partnerships like that. Any last questions? We'll give it another minute or two. And if you think of questions after the call, feel free to reach out to us through these contact methods, and we'll be happy to follow up with you. But we have not been getting any more, so I think we will end the webinar. And we really appreciate your attention and your interest in our data, and we hope that you can use this to become more efficient and effective and impactful. So have fun exploring the data.